Hi, my name is Dr. Jerry Del Cannon. I've been a practicing chiropractor for almost 3 decades in Murraysville, Pennsylvania. A couple of years ago, when COVID came onto the scene, I realized that there was a change in the way people viewed their health. There was a major paradigm shift, which was in some way a good thing for people starting to find a way to take care of themselves. How can they be healthy? They understood that medicine's not going to cure all their problems, and as we know, a lot of surgeries that are being performed out there are not needed or don't actually fix the cause of the problem. Today on our show, we're going to talk about piriformis syndrome. Some of you may have heard of that before. You may have heard of the piriformis muscle. It's the muscle in our buttocks that helps us rotate or turn our foot outward. The piriformis muscle sometimes can become entrapped and cause sciatic-like symptoms. So sciatica, as many of you have heard or may have experienced, is a pain which radiates from the lower back and down, oftentimes all the way down to the underside of the foot. With piriformis syndrome, it can mimic those exact types of symptoms as sciatica. However, the cause of it comes from a different location, and that's the piriformis muscle, which we'll be talking about momentarily. So as we talked about earlier, the sciatic nerve comes out the left side and the right side. Here, you can see it in yellow. The nerves come out of the lower back and out of this sacrum to form one large nerve which travels down your leg. On the right side, you can see this muscle right here. This is the piriformis muscle. Sometimes that nerve, which comes down past that muscle, can become entrapped when that muscle gets very tight. So the piriformis muscle, if you think about driving a car, imagine taking your foot from brake to gas and brake to gas. That's when that muscle gets very tight. A lot of times people with piriformis syndrome or piriformis muscle hypertonia notice a discomfort primarily when they're driving or after they've been driving for a while. In fact, in 15% of people, the sciatic nerve actually pierces in between the piriformis muscle as it goes past the buttocks and all the way down the leg. When this nerve becomes entrapped in this area, we can get pain, weakness, numbness, tingling, and a loss of coordination, and can actually be very detrimental to a person's health and safety. So in order to correct the problem, we need to find out, number one, why is this muscle getting so tight? And we found many times it's because this joint right here called the sacroiliac joint, where your sacrum meets the iliac part of your hip or your pelvis. When this joint doesn't move and articulate well, all the stress is placed on this muscle, and when this muscle gets overused or overstressed, it can become tight, and as we talked about earlier, entrap the sciatic nerve. Oftentimes, sciatica can also come from problems in the lower back, but piriformis syndrome always comes from the piriformis muscle being hypertonic and compressing the nerve as it goes down your leg. So as you can see, it's not real difficult to diagnose piriformis syndrome. You just have to do the right tests and look for the right signs. As far as fixing it, it's relatively easy once you know what the problem is. Creating motion in the sacrum, in the low back, and making sure you're doing the proper stretches to increase the length of the piriformis muscle. If there's a short leg syndrome, then sometimes we have to address that as well by adding a very small wedge into the shoe that you wear most frequently. Another cause of piriformis syndrome can be a short leg. It can also be sitting on a hard chair regularly throughout the day, but most of the time it's due to poor posture. When we have poor posture, we do get excess stress and strain on the pelvis, onto the low back area, and that, as I said earlier, can cause a loss of motion, loss of function, and when that happens, then our body starts to respond in a negative way and can lead to this entrapment. I started to see many patients coming into the office that weren't normally the normal chiropractic patient. We were seeing older men who had been reading online about natural health care. They wanted to find some different answers. We'd see a lot of families bringing younger people in because they definitely didn't want to take the medicine or maybe were afraid of taking the vaccination. So we had a lot of different people asking questions, and I think that that is actually a good thing. Unfortunately, COVID was very bad and we lost many people, but there's definitely a shift and people are now trying to be healthy. So on our channel, we created this, and the programs that we have on here, we created these to help you with some questions that you may have. Things that are going to change your life, things that you can use on a daily basis. We want to take a lot of the information that's out there and debunk some of the medical information that you may have heard, or debunk some of the chiropractic stuff that's out there as well. We want to educate you so that you can be healthier, so we can help you in your life. So we hope you stick around. Check in. If you like our show, please like it. If you follow us, we'd really appreciate it. We hope you enjoy what we have for you, and stick around and we'll see you soon.